Good morning, everyone. It is indeed my pleasure it's really my pleasure to welcome all of you to our virtual gathering today on June 18th, 2021. For the guests who have joined us, I'm Sharon Devaskar, and I'm the chair of the Department of Pediatrics. Today is a very special day, as many of us have zoomed in to celebrate the graduation of our Pediatric Fellows. We're all experiencing mixed emotions. You know, it's a feeling of pride for what our fellows have accomplished over their training years, but also a sense of loss as they move on to the next chapter in their professional journey. We have all seen firsthand what they've accomplished and are capable of over the years, becoming part of our family. But especially during the last year and a half, we've all been confronted with the pandemic and social and racial injustice all around us. But the resilience, adaptability, and creativity you all have shown is truly commendable. Many of you had to balance much in your personal and professional lives while still pursuing your passion of caring for your patients. Some of you even volunteered to care for the unaccompanied minors at Long Beach, teaching your junior peers, residents, and students, and interacting within multidisciplinary teams, immersing yourselves in your scholarship, much of which was on display during our recent 2021 CDI Symposium. I got such positive feedback about the success of all our fellows who were shining brightly, owning their projects with pride. We have witnessed also a week where our Supreme Court upheld the Affordable Care Act yet again, continuing healthcare for many. And on the world stage, we pledged SARS-CoV-2 vaccine doses to many without the means and declared Juneteenth as a federal holiday. Not quite enough in the hearts of many of us, given the circumstances we're facing today, but nevertheless a commemorative moment after so much time. These are indeed trying times as we collectively face them. Our graduating fellows will be joining us, becoming our colleagues, forging ahead as trailblazers and change agents of tomorrow. We will always be proud of your accomplishments as we hope to retain connectivity with all of you, no matter where your aspirations may take you, some of you staying on here, of course. But you will all agree when I say none of you could have gone through your fellowship training without the support of your family, parents, siblings, spouses, significant others, and children. They've played an incredibly important role in being there for you, supporting you, and being that strong shoulder or the purpose motivating you to keep going. I would like to take this moment to acknowledge all the support your friends and family have given you throughout these years of training, through good and hard times. We thank you for being there for our graduates, and I'm just going to applaud for all of you who've joined us today. Your program directors and coordinators, all the staff, division chiefs, divisional faculty, and faculty who lead departmental medical education, clinical, and research missions, your mentors, Doctors Enciso, Lehman, Wesling, Perry, and Huang, and many more who have brought you along to achieve your individual goals within the larger context of those we are privileged to serve, the children and their families. So congratulations to all of you, the Pediatric Fellowship Class of 2021. I really want to applaud all of you, and I know there'll be more celebration to be had today. But I wish to thank all responsible for organizing this special day as I turn over the program to Dr. Josephine Enciso, who's the Director of Pediatric Fellowships and is the Master of Ceremonies this morning. Dr. Enciso.
Thank you, Dr. Devaskar. And good morning, everyone. It's good to see so many of you here and to celebrate our graduates. We have 23 graduates, outstanding individuals, and we will highlight all their accomplishments and where they're going to be off to and their next big steps. So first up, we will have the pediatric program, subspecialty program directors present their fellows. And we're starting with Dr. Jeremy Moore from Pediatric Cardiology.
Thanks, Dr. Enciso. We'll start with Benjamin Blaze, our first Pediatric Cardiology Fellow. Ben Blaze came to us, he did his medical school training at Dartmouth College, and then he did his residency at UCLA. And we've known him for a long time. He did a fabulous job as a resident, and we've obviously kept him as a fellow here. Ben is incredibly introspective and thoughtful. He's very academic, but at the same time, he is a fabulous budding pediatric cardiologist. He is an excellent clinician, and he's basically good at everything. If you go through his qualities, he's good at computers, IT, he's good at artwork. He's done illustrations for different publications over the years. He's actually very athletic. He does apparently does a lot of weightlifting. And he even speaks several languages, including French. So so Ben basically can do pretty much anything. If you look at his PubMed citations, he's also published multiple times over the past few years. He's got, I think, 5 different publications during fellowship. And he's even got a multi-center study that's under review currently that I think is going to be published very soon. Ben has shown an interest in interventional cardiology in the cath lab. And he is going to be staying with us here at UCLA for an additional year in cath training with Dr. Levy and Dr. Abelhosen. So we're really excited to keep him here. He's one of our great graduating fellows. Yeah. And the next fellow we have is Pina Patel. Pina did her medical school training at UCI, and then she did a residency at Chalk. She stayed as she was a chief resident there, and that kind of, I think, also displays some of her qualities, which is great at management skills, interpersonal skills. She's great with families. She's great with other physicians. She's able to really navigate complex clinical situations, interdisciplinary teams. She's got a knack for management decisions, and she's got a strong clinical acumen. She's been a pleasure to work with over the past several years. Pina's also shown us that she can do some great translational research. She's done a project with Nancy Pike that's involved single ventricle population and brain development, looking at MRIs. And she's done some interesting findings from that research over the past year, and we're really excited about that. Pina is interested in imaging, so she's going to go on to do a 4th-year fellowship at Texas Children's Hospital in imaging, and she's going to combine that with furthering her research skills. The two combined during her fellowship, and so I think she's going to turn into she's already become a great physician scientist, and I think she's going to continue to advance those aspects of her career in the next year. And we really hope to see her back here at UCLA someday. We're really excited for her as well. So those are our 2 graduating pediatric cardiology fellows.
Thank you, Dr. Moore. Next, we have Dr. Patricia Wang from Pediatric Nephrology to present her fellows.
All right, so it gives me great pleasure to present our 2 graduating fellows, Reem El-Chaki and Christina Farkas-Skiles. I will first present Reem. Reem came to us from the Weill Cornell Medical College in Qatar, where she went there for medical school, and then she completed her pediatric residency at the Women and Children's Hospital of Buffalo. Reem was quite productive during her fellowship, working on a few research projects, one with Dr. Robert Fennick, looking at the long-term pediatric predictors and risk factors for chronic kidney disease and hypertension in pediatric liver transplant patients. This project is in its final stages, and Reem is preparing the manuscript for this study. Another project that Reem was involved in was with Dr. Megan Pearl, studying AT1R and ETAR antibodies, proteinuria, and renal dysfunction in pediatric kidney transplantation population at UCLA. She also was pretty involved in an industry-sponsored study from its inception, a prospective randomized single-control study looking at Envarsus, a long-term tacrolimus type medication to evaluate the efficacy, safety profile, and medication adherence in our pediatric population. So she's been involved in several different projects from the scholarly activity perspective, and has been quite successful. For those of you who have worked with Reem, you probably already know that she's an extremely hard worker, very thorough yet efficient, helpful to not only her colleagues, but really to everyone. Reem, in the 3 years that I've known her, she does not have a mean-spirited bone in her body. She's actually quite often the opposite, often looking always at the positives instead of the negatives in a situation. Clinically, she's always engaged, focused, and dedicated to the care of her patients. She'll often go above and beyond what's expected of a fellow, and in order to do what's in the best interest of the patient. It's really been a true pleasure of mine to see Reem grow over the past 3 years into an excellent pediatric nephrologist. She's always extremely professional in her interactions with others and a very good team player. Reem will be sorely missed, and I have personally heard several people, including other house staff, support staff, and faculty say that they will miss her energy and positivity once she graduates. During her fellowship, Reem also had a beautiful baby boy, which you can see here on the screen during her 3rd year of fellowship. But as usual, even through her pregnancy and after maternity leave, she was extremely hardworking, never complained about calls, being tired or fatigued. She always had her same upbeat, positive attitude about her work. Reem's plans after graduation remain to be determined, and she'll first take a few months off to spend some time with her husband, Paul, and their son, Zane. I speak on behalf of the entire pediatric nephrology division. We wish Reem all the luck in the future and know that she'll succeed wherever she goes. The next fellow that I will present is Christina Farkas-Skiles. Christina came to us from the University of California in San Diego, where she did her undergraduate studies, where she's also elected to the Phi Beta Kappa Society. She then did her medical school at Vanderbilt University in Tennessee, and her pediatric residency at UCLA. We were fortunate enough that Christina chose to stay with us at UCLA for her pediatric nephrology fellowship training. Christina was also extremely productive during her fellowship in terms of her scholarly activity. She's had multiple projects. She worked with Amy Waterman in the Kidney Transplant Research and Education Center on a project looking at delays in pediatric kidney transplantation waitlist activation and getting the perspectives of families and providers. This project was presented as a poster at the American Transplant Congress this past June, earlier this month, and the paper is now in preparation to be submitted. Christina also worked on another project looking at a new de novo glomerulonephritis that she identified in pediatric non-abdominal organ transplants, mainly liver and small bowel transplants. This project was also presented at the American Transplant Congress in 2018, as well as at the ASPN and PAS conference in 2018. And just this past week was accepted for publication in the Pediatric Nephrology Journal. Christina also spearheaded a really nice quality improvement project looking at the standardization of IV fluids in inpatient unit in pediatrics. And she was a site lead at UCLA for this project for the AAP VIP network. So besides being incredibly productive in terms of her scholarly activity, Christina also during her fellowship got married. She's now expecting her first baby with her husband, Michael. It's been incredibly rewarding to see Christina's journey from being a pediatrics intern here at Mattel Children's to now a budding, excellent pediatric nephrologist. Christina is very hardworking. She always puts also the interest of her patients first. She is by far the first person to look up any evidence-based medicine articles related to her patients. She often eagerly will share the latest data with the rest of the division. Her enthusiasm for nephrology is truly inspiring to see, and I know she'll continue to grow as a clinician and clinician educator. She is able to do anything she sets her mind to and is determined and has a very strong drive to always do better. Christina will not be moving too far from us. She'll be joining the faculty at Miller Children's and Women's Hospital in Long Beach. And I know that Christina will contribute greatly to the field of pediatric nephrology in the future, and I'm so excited to see what the future has in store for her. Please join me in congratulating both Reem and Christina.
Thank you, Patty. Thank you, Dr. Wang. Next is Dr. Maria Garcia-Loret to present her graduates in allergy and immunology.
Hi. Well, good morning to everyone. I realized that I had a very different speech prepared, and so I go on. I have to, and I think I echo the spirit of all the program directors, that I love my job. I'm so blessed to be able to see our fellows grow year after year from trainees to colleagues. And I have the department, to thank for, but more important to the fellows as unique as Lisa and Dan. I love my job 364.5 days of the year. There is a 0.5 that is the night prior to graduation where I toss and turn because I don't know exactly what, which are the best words to express how much they've given to the program and to express their unique awesomeness. That being said, I'm going to go with awesome number one, that is Dr. Daniel Cerrone. Dan came to us through many different ways, but more importantly, he did his medical school in Indiana. He did his residency at Loma Linda. He did his fellowship, his first fellowship as a pulmonary in CHLA, and then decided to join us. And Dr. Cerrone very quickly became, where is Dan? And it's been where is Dan because Dan is everywhere. Dan is always ahead and behind and always dressed for the part. His talents are incredibly, broad. He's an excellent clinician. He taught us a lot about pulmonary medicine. He built and supported, new projects in the area of genome analysis. He's been an amazing doctor, and his patients, now that they know that he'll leave, have been very, very sad, as we'll all be, because we will miss him. Dan has an incredible moral fiber, and he has been productive in many ways that I can describe. He initiated his own research during the time of COVID, looking at the effects of inhaled corticosteroids in COVID severity. And he presented an abstract that he cooked from A to Z by himself at the CDI conference. There's more than I can say about, Dan, and I will go on and on like many of his co-fellows and many of his patients. As a gem as he is, UC Davis snatched him from us, and he will be a professor, an assistant professor of pediatric allergy and immunology up in Sacramento. I anticipate we will maintain strong ties with UCLA. He knows we won't let him go that easily, and we are very, very proud at this time of graduation. Well, awesome number two is I'll present the second fellow, that is Lisa. And is awesome number two just because of alphabetical order, not because of quality order. Lisa is a homegrown gem. Although, like Dan, she had a little stint at our cousin institution once removed. That has been long time forgiven. She joined us after her MD, PhD, and her residency almost 3 years ago. And what I can say from Lisa is that she has mastered the art of constructive questioning, because this is Lisa. Lisa will question everything. in a good way. She will question the literature, she will question the research, she will question the way that we do things, because she's always looking forward to improving she wants to know why we do it and how she can improve it. In contrast to that, Lisa came from a very well-trained basic immunology background, but we knew she was smart. We knew she had, constructive questioning, but what we discovered in her is her appreciation for clinical care and her appreciation for patient care. She has established very fruitful relationships with very complicated patients that usually come with complicated families, and established herself as a top clinician. And I say that also about the constructive questioning, because she questions us. I'm sure she would question her dogs if she found a bowl and turned and the food in the floor. And we want to know why he did it. But more importantly, she questions herself. And that is a unique virtue. She has questioned herself, and she has found the courage to find her own way. And I anticipate that we will continue to discover in her things that she doesn't even know herself that she has. I have to say, Lisa will stay for a little while, continuing a superb research that she has done under the mentorship of Maureen Su in the area of epigenetics of autoimmunity. And we anticipate and we hope that she will stay on in faculty after her research is completed. And lastly, I would say that awesome number 3 are the families of both Dan and Lisa. I can say that because I see fellows year after year. You guys have given them extraordinary roots, and you have polished their wings. Your parents, your grandparents, Ken and Allison, you should be proud of yourselves, and I have the privilege to enjoy your work. You have made sure that not only that Lisa and Dan not only will do good, will also do well and will honor our institution and the place where they come from. That's all that I have to say.
Thank you. Our next presenter is Dr. Mirio Cho, who is going to present to her graduates in child neurology.
Thanks, Dr. Enciso. It is my pleasure to present our graduating residents in child neurology this year. Just a brief kind of explanation of how our program works. For those of you who have fellows in pediatrics program, our residency is a little bit different. And although we're thrilled to always be included in the fellowship programs within pediatrics, we're actually a residency. And so our trainees go through 2 or 3 years of pediatrics residency, complete a year of adult neurology, and then come to us in their 4th and 5th year, typically 4th and 5th year, for their residency in child neurology. Both Dr. Grant Tejada and Dr. Shrestha joined us for the adult neurology year, having completed their pediatrics residencies elsewhere. So I'll start with Dr. Grant Tejada. Originally from Puerto Rico, Dr. Grant Tejada completed medical school at Universidad Central de Caribe School of Medicine before completing her pediatrics residency at the University Pediatric Hospital in San Juan. During her residency, she conducted a study investigating treatment for infants with congenital hypothyroidism identified in the newborn screen, and presented this work at the 2017 PAS meeting in San Francisco. She worked as a general pediatrician before beginning her residency with us in July of 2018. Pia is a really conscientious physician and always thinks about the whole patient rather than just the neurologic problems. For her, patient care always comes first, and whenever she is on service, I am confident that all of the patient's needs are being attended to. During her residency, she has been involved in numerous volunteer experiences focused on taking care of children with neurologic disorders, including neuromuscular disorder. Pre-pandemic, she worked closely with me, completing pre-participation neurologic exams for high school students participating in sports. So I'm particularly excited to have her continuing her education here at UCLA in a combined sports neurology and headache fellowship. So congratulations, Dr. Grant Tejada, on completing residency, your 2 residencies. Okay, and next, Dr. Shrestha. Dr. Shrestha joined us in July 2018 after completing his 2 years of pediatrics residency at Sinai Children's Hospital. Originally from Nepal, he graduated from Nepal Medical College in 2012, where he regularly volunteered in community health camps and conducted research trying to better understand the specific needs of the families and villages there. He worked as a medical officer in Nepal before coming to Chicago for his training. Gyan has been an extremely sharp resident. When we're on service together, he sometimes, and really I wrote sometimes, but I think often is more the case, challenges my plans, especially for the epilepsy patients. And because of his sound reasoning, we often go with his plan. As the residents know, I often say, there isn't always a right answer in peds neuro. And so the choices of treatment or management plans is really up to whoever's leading the team. And so when Dr. Shrestha is leading the team, we're often going with his plan. He has already been involved in a few research projects with the epileptologists here. So we are particularly thrilled that he will be staying to complete a pediatric epilepsy fellowship with us starting in July. Congratulations, Dr. Shrestha.
Next, we have Dr. Micah Fetterman, who will be presenting her graduates in critical care.
Thank you so much, Dr. Enciso and Dr. Devaskar. I wanted to start by saying congratulations to all of the fellow graduates this year. You've all worked incredibly hard during your fellowship under unexpected and uncharted conditions, taking care of complex children and their families, as well as your own. And I have no doubt that each and every one of you will make excellent ambassadors for UCLA as you go out and start the next phase of your career. But I am particularly proud to announce the 3 graduates from critical care this year. Our 3 graduates have made their mark on our program, and I'm so thankful that each of them did their training here. First, we have Arham Ali, who we all know as Ali. Ali did his medical training at Ziauddin University in Pakistan, and then he received a master's in cell biology and completed a T32 postdoctoral fellowship in pediatric burns at the University of Texas Medical Branch. He then completed his pediatrics residency, shared between 2 programs who were lucky enough to have him at Crozer Chester in Pennsylvania and Advocate Christ in Chicago. And finally, he came to us for his critical care fellowship. During his fellowship, he worked with Dr. Anil Sapru on his project in high molecular weight adiponectin in critically ill children, expanding on his interest and experience in metabolism. He was the recipient of a fellowship research grant from the CDI to support his work. Dr. Ali is a dedicated father to his adorable kids, who we've got to see on Zoom much more this year. And they're here this morning wearing amazing glasses. And he's a loving husband to his wife, Farah, and a caring son and son-in-law, brother, etc., to his extended family, some of whom I see here this morning. But what makes Ali special is that he is truly one of the finest human beings I've ever met. Sorry. He's humble, he's kind, he's sensitive, he's generous. And this has never faltered during any day of his fellowship training. So Ali isn't going far. He's just going to Loma Linda. They're lucky enough to have lured him away, but we're happy that we'll get to see him during this next phase of his career. So congratulations, Ali. Our next graduate is Jacob Kubian. Jacob is from SoCal, did his high school not far from here. He then went to Harvard. Did you know he went to Harvard? So he received his degree in molecular and cellular biology from Harvard College in Boston. He then received his medical degree from Emory University in Atlanta, did his residency at UCI in Chalk, and then came to us for fellowship. During fellowship, he did his research with Dr. Payman Ben-Harash in the Cardiac Outcomes Research Lab, where he studied the use of ECMO in congenital heart disease and also pediatric influenza hospitalizations in children with congenital heart disease. And one of these was already published in Pediatrics in 2020. Dr. Kubian will not be forgotten by our division for a very long time. I didn't see these slides because, of course, he turned them in last night. So it's true to form. He is often late to the party and maybe needs a few reminders to get his work done. But in all seriousness, Jacob has a true passion for learning and for teaching. He has pushed our fellows and our faculty forward. He has been a supportive partner to me as a program director and helped make lasting improvements to our program. He is an incredibly talented physician, and I know he will make a difference in the lives of many critically ill children in the future. And I couldn't be prouder to say that Jacob is continuing on in fellowship to enrich the life of yet another program director at Cincinnati Children's, where he'll be completing a fellowship in pediatric cardiology. So congratulations, Jacob. And our last graduate is Laura Maitosa. Laura received her undergraduate degree in biology with a minor in chemistry from Santa Clara University. She received her medical degree from Creighton University. She then did residency at Harbor UCLA, and after that completed a fellowship in cardiology at Yale University in New Haven. After her first fellowship, she realized there were more fellowships to do, and so we were lucky enough to recruit her to do her critical care fellowship here at UCLA. And even though she didn't have to do it, she did some research while she was here. She played a key role in a multi-center trial looking at resuscitation outcomes in the ICU. And she also worked with me to study the use of whole blood during cardiopulmonary bypass for children needing congenital heart surgery. Laura has really been a tremendous asset to our program, sharing her cardiology knowledge with us and always working hard, though mostly under the radar. And as you can imagine, it's a lot of work and pressure to complete a critical care fellowship in 2 years, but she did it with true grace and grit. Now, Laura is an unusually quiet intensivist. Those of you who hang out with us know we can be a little loud, but this is what makes her special and unique. She is unassuming, but super knowledgeable. She is always humble and extremely professional. She is a sensitive and supportive friend and colleague. And we could not be more thrilled that Laura will be staying here at UCLA as a member of our division. I know she will be an excellent clinician, colleague, teacher, and I can't wait to see firsthand where her career takes her. So congratulations to all three of you.
Thank you. Next, we have Dr. Dennis Chi presenting his endocrinology fellows.
Thank you, Dr. Enciso and Dr. DeVascar. It is indeed my pleasure to present Dr. Eric Tsai, who is our graduating third-year pediatric endocrinology fellow. Dr. Tsai is from Northern California. He did his undergraduate studies at Berkeley, where he majored in molecular and cellular biology. After a brief stint in industry, he went on to do medical school and pediatric residency at Loma Linda. And as you can see from the slide here, as a little preview, he kind of is coming full circle in that sense. We were lucky enough to recruit him to our pediatric endocrinology fellowship. Actually, was not part of the process in that both Eric and I started at the same time. So this is a little bit special for me as well, because I'm hitting the 3-year mark with him. Personally, Eric is soft-spoken, but he makes a point of always getting his impressions heard and has much to contribute. He's always looking to improve, and expand his breadth of skills. Eric is very inquisitive, and he's very conscientious with his patients and with his follow-up. With regard to his scholarly activity and some of the qualities that I mentioned before, he's been an active participant in 2 different programs here at UCLA, obviously beyond the departmental fellow educational programs that we have in place. He has done the 2-year translational science certification program. And this past year, he has also completed the resident informatics program. Within that, he has had a couple research projects. His primary research project is with tenasmoin, which is on barriers to continuous glucose monitor in adolescents. And he has also, within the informatics program, studied no-show rates for telemedicine appointments for type 1 diabetes. As I mentioned, we're pleased that Dr. Tsai has found an excellent position for him at Loma Linda, where he'll be an assistant professor of pediatric endocrinology. He's really been a pleasure to have in our program at a time when, obviously we all know in the past year and a half it's been challenging. And he's been a real role model for our first year fellows who've come on, making sure that they know what all is in place for them and that our clinical care remains in stride. And with that, I'd like to congratulate Dr. Tsai, and I look forward to working with him in the future. Thanks.
Next, we have Dr. Sue McDermott from gastroenterology to present her graduating fellows.
Good morning, everybody, and thank you, Dr. Niso and Dr. Davaskar, and congratulations to all of these wonderful, inspiring young physicians as they enter the next phase of their life. My job is to talk about my 2 graduating fellows, who I'm incredibly proud of. Before I introduce each of them separately to you, I just wanted to share with you some observations about both of them, because the last year, I think, as we all know, really was a crucible for seeing how all of us react under very unusual circumstances. So for Samia and Rudy, these 2 fine young people, they epitomized the philosophy of stay cool, stay calm, get it done, don't complain. And they spectacularly performed during this past year. I think what was very important to all of us is to have our 2 senior fellows be so supportive of our junior fellows through these really unusual and difficult times. And at the same time, they were both very supportive of us, the faculty, who was trying to figure out the way to do things safely, not only for ourselves, but of course, most importantly for our patients. Both of them led by example. They did not make a lot of fuss, but I could always rely on them to have the inside scoop on what was happening within the 6 fellows that form our fellowship in our division. And I would say the other thing about both of these amazing young people is not only are they very fine physicians, but they epitomize too something that is often not spoken about, but is so essential to a subspecialist, is they look at the whole child, the whole family, and they treat each of their patients not only with compassion, but with respect. And so those are some general comments about both of them, but let's take a look at each one of our 2 fellows. So first up is Samia, ladies first. Samia Pathak. Samia, thank you very much for these very nice comments that you've made. I think that you are going to be an amazing addition to our faculty. Samia's going to stay with us, and she's going to man some of the outreach clinics. But first, just by way of background, she came from the colder reaches of the North. She was an undergraduate from Michigan, went to medical school at Children's Hospital of Michigan, and then decided she really needed to have some warm weather. And so we were lucky enough to attract her to our fellowship program. She has done a very important research study in irritable bowel syndrome, and she has published on that particular subject. Samia is kind, very, very kind. She's very patient. Her families love her. And so I know that she's going to be a great success as she forges new paths for pediatric gastroenterology in the community. And just on a personal note, you can see Samia here with Brent, her mainstay. I think that Samia probably has the record for the most number of canceled weddings that I've ever heard of. I think she's tried to get married about 3 or 4 times, but every time she tried, COVID got in the way. And so she said, you know what, I think we're not going to do this because it's not going to be any fun. So we're anxiously awaiting the day when there's going to be a big party for Samia and for Brent. So there's a lovely picture of the beautiful Samia. So next slide, please. So now we go to Rudy Silva. So Rudy, you can see here looking very professorial, I would have to say, in that top left-hand photograph. Rudy was an undergrad from Berkeley, medical school at Davis, and then did his residency at Loma Linda. Now, Rudy came to us. We actually stole Rudy from Loma Linda. We had an unexpected gap in our fellowship, and we heard that Rudy was very interested in pediatric gastroenterology, and he had started his chief residency at Loma Linda. So, you know, I'm never known to be particularly shy. So I called Rudy. I spoke to his residency director and tried to make peace with her as I unabashedly stole Rudy from his chief residency so he could start fellowship here with us. And that was really a wonderful opportunity for us, and I hope that it has been for Rudy. So Rudy is one of those folks that always is prepared. He knows exactly how to present the patient in rounds. He's already read the literature. He teaches us all and himself at the same time. And he is going to be a great addition to the Loma Linda staff. So I guess he's going to join Ali there. But I have a feeling we're going to hear quite a lot from Rudy. He did catch the transplant bug. And I think that he is going to want to be able to continue to help us with the Loma Linda cadre of children that need to be transplanted. He took his interest in transplant into the basic science lab during the last 2 years and did a very complicated project regarding macrophage trafficking in the lab of Dr. Reed. And his paper is already on the way to being published from that. So I cannot thank both of you, Rudy and Samia, for the loyalty and the support that you've personally given me and to the rest of your co-fellows and to our division. I'm so proud of you, and I know that you're going to enrich the lives of children with pediatric gastroenterologic and liver diseases for many, many years to come. So good luck, and we'll always be here to help you. Thank you.
Thank you, Dr. McDermott. Next is Dr. Gavin Roach, who will be presenting his graduates in hematology oncology. Dr. Roach.
Good morning, everyone. It is my great pleasure today to be able to introduce and congratulate our 2 graduating pediatric hematology oncology fellows this year. It seems as though every year we get a great new batch of first-year fellows, and our first-year fellows tend to bond with one another due to the shared experience of our intense clinical year during the first year of fellowship. But I think Ashley and Brian have really bonded in a way that surpasses that of most of our usual fellows. They've both been really, really outstanding. I can't say enough about what they've been able to accomplish during their time with us these last 3 years. Both of them persevered through a pandemic and were able to work on numerous scholarly activity projects during their fellowship. Both of them ended up going into areas of research within hematology and oncology that they were not intending to at the start of fellowship. but they have really jumped right in. And it's been really exciting for us to watch them as they succeed in their research endeavors. Both of them were able to submit and be awarded competitive grants through the T32 programs here at UCLA. And as I said, I think they really bonded in an especially close way, so much so, in fact, that they affectionately refer to one another as the work husband and the work wife. Although I can say that that is purely a joke. In fact, Ashley has a husband in real life that she married during her time with us in fellowship, and I know he's listening in today, so I don't want to give the false impression there. So to start off, I'm going to talk about Ashley. Ashley Gray got a BS in physiologic science from UCLA, and then also pursued a master's degree here at UCLA, where she studied prostate cancer and dietary interventions. She then went to St. George's University to get her doctoral degree and then her pediatric residency up at UCSF Fresno. I've known Ashley for a while because she did do some rotations with us during her residency before she ever came to fellowship. And I can say that right from the start, Ashley was determined and eager, talking about her potential research projects even, a year before starting her fellowship here. She ended up, her primary research project was looking at longitudinal changes in the gut microbiome during hematopoietic stem cell transplant and the association with severe acute gut GVHD. She actually had this idea to do a pilot study looking at the feasibility of fecal microbiota transplant. In other words, taking poop specimens and giving them to transplant patients to see if it would affect overall rates and severity of gut GVHD. She went so far as to be able to submit an investigational new drug application for this project. She worked very closely with her mentor in infectious diseases, Dr. Grace Aldrovandi, and Ashley affectionately became known as the poop princess because she could always be seen running around trying to collect stool specimens from our transplant patients. Unfortunately, because of the pandemic, her research was a little bit derailed for a while, but not to be discouraged, Ashley jumped right in with some of the other projects that were going on in Dr. Aldrovandi's lab, including many projects looking at the SARS-CoV-2 infection and vaccination. She was instrumental in helping to get the healthcare worker study off the ground here at UCLA for surveillance for SARS-CoV-2. And she's also ended up having a couple of publications out of her role in those studies. Ashley's plans for the coming year are really exciting. She's going to go up to the Fred Hutchinson Cancer Research Center at Seattle Children's Hospital, and she's going to be their first inaugural fellow in bone marrow transplantation. So that's going to be a 4th year of fellowship for her for that specialty training. And we are really excited to see how she's going to succeed up there. Congratulations, Ashley. Our second fellow who's graduating is Brian Na. Brian got his bachelor's in history and science from Harvard University and then his doctoral degree at Drexel University College of Medicine. He did his peds residency at Rainbow Babies and Children's Hospital in Cleveland before he came here to UCLA for his fellowship. Brian came in thinking about one type of research and ended up pursuing another. He actually jumped right into a basic science research lab with his PI, Dr. Marco Giovannini, and he liked the research that he was doing in atypical teratoid rhabdoid tumors so much that he decided to apply to our STAR program and actually pursue a PhD. And he was accepted into that program. And we're very excited that after his graduation, Brian's going to continue to work here at UCLA on obtaining his PhD degree. His research project with Dr. Giovannini is entitled Elucidating the Molecular Landscape of Atypical Teratoid Rhabdoid Tumors, or ATRT. And he's actually been working on several different projects in the lab, including trying to validate an existing mouse model of ATRTs, which is a malignant pediatric brain tumor. He's looking at 3 subgroups of that disease and examining how each subgroup occurs to identify possible targets for therapy. He's also looking at ATRT in a pig model using contemporary gene editing techniques. And then lastly, also working with investigators in the School of Engineering to further elucidate the role of cold atmospheric plasma as a possible treatment for neurofibromatosis type 1 tumors. As I said, Brian has really jumped in to the basic science that he's been working on. We're very, very lucky to have him staying on with us, not only as a PhD student, but also as a clinical instructor within our division. And I'd just like to take a quick moment to give Brian the recognition he deserves, that he's really been taking on an attending role over the last year, taking over the care of our pediatric brain tumor patients. And he's worked very, very hard on that. And we're very excited that he's going to be now leading our neuro-oncology program starting in July. So again, congratulations, Brian, and congratulations, Ashley. We are very, very proud of both of you.
Thank you. Next, we have Dr. Deepa Kulkarni to present her Hospitalist Medicine Fellows.
Thanks, Dr. Enciso, and congratulations to all of our graduates today. I'm excited to present our two graduates from our Pediatric Hospital Medicine program, Esther Jun-in and Elena Ng. So just to give some context, our program is only 2 years long, which means that our graduating fellows have spent about 2/3 of their fellowship in a pandemic. And despite numerous curveballs, they've showed exceptional resilience to not only get through this challenging time, but to somehow excel during it. For example, they noticed that with our social distancing and new visitor policies, we had a little bit of a breakdown in our family-centered rounds. So they found an effective way of including all of our team members and families via Zoom, which earned them first place in a $50,000 grant from the UCLA Innovations Challenge, as well as a presentation of their work at a national conference. They also found a new clinical need as our adult hospitalist colleagues struggled to keep up with the immense volume of COVID admissions, and they immediately volunteered to help on the adult COVID units. They both received Cultural North Star recognition for their amazing display of compassion and collegiality. So just to focus on Esther for a little bit, I found it hard to figure out how to include all of their accomplishments in our time given, but I'll try. Esther joined us after completing residency at UCLA, and we were excited to have her stay on as a fellow, and she has accomplished so much in these 2 years. She's writing a textbook chapter for a board review book. She already has a publication on the care of complex children in the emergency department. Her primary research project, focusing on procalcitonin as a predictor of bacteremia in children with intestinal failure, has abstracts that have been presented or accepted at 2 national conferences, both PAS and PHM. She's also had a case presentation presented at PHM. She also did extensive QI work on standardizing the care of patients with neonatal abstinence syndrome. She created a pathway to help with this process and realized that it would benefit from integration in our electronic health records. So she applied for to be a resident informaticist. And through that, she was selected as a winner amongst all of the projects across the health system at the annual Resident Informaticist Symposium. And also she won a Physician Collaborator Award that was nominated by the nurses and ancillary staff and was given to her by the Santa Monica Board of Advisors. We are so excited to have Esther joining us as faculty here within our UCLA Hospitalist Division. Congratulations, Esther. And moving on to Elena, who's equally accomplished so much in this past 2 years. She joined us after completing a patient safety fellowship at Kaiser and hit the ground running. She is working on, or has completed and is working on, chapters in 2 different textbooks on high value care. She also has her primary research project on optimal carrier fluids in pediatrics and has an abstract accepted at our national conference in PHM coming up this summer, as well as 2 case presentations at our national conference as well. She also applied for and was accepted to the medical education fellowship that she completed during at the same time as her PHM fellowship, as if she didn't have enough going on. And through this, she created a shared curriculum for PHM fellows across the region. We had our first SoCal PHM Fellows Consortium held earlier this week, and it was an amazing start to a collaborative relationship across institutions. Looking at her resident feedback, it is unanimous that she is a great role model and leader as it relates to leading a team. Residents often comment on how meticulous and great she is at giving feedback and coaching them. And one resident actually wrote, "I wish all fellows and attendings did this." We are thrilled to have Elena joining us as well to stay on as faculty at UCLA in our hospitalist division. So congratulations to you both.
Thank you. Next, we have Dr. Jaime DeVille to present the infectious disease fellow graduates.
Good morning, and thank you so much for the opportunity, and congratulations to all the graduating fellows and everybody that has been tremendously responsive during this very difficult time. So we're gonna move on to talk about how proud we are of our graduating fellow, Rachel Martin Blaze. Graduated from Dartmouth School of Medicine and went on to join our residency at UCLA before being so fortunate for us to join us in our fellowship in 2018. And she has been incredible since the first day, showing her commitment to clinical excellence and the attention to detail in evidence-based practice, the way that she cares for the entire patient and has taught us, even as faculty, new ways to look at approaching the patient as a whole. Her presentations have been truly outstanding. I cannot remember anybody doing as good clinical presentations as Rachel has done, whether it would be in journal club or case presentations. And she has really set a standard, not just for pediatric infectious disease fellows, but whenever we have a joint conference with adult ID, that has been really a highlight. She has some adventures with us, obviously, during the COVID pandemic. And just to illustrate, she had to change her focus of research from her project in long-term follow-up on congenital syphilis in Brazil when the pandemic hit. At the time the pandemic hit, she actually was taking the gorgeous course of tropical medicine and had to be evacuated back to the U.S. But promptly made an adaptation and started working on a healthcare worker project along with Dr. Aldravandi, which has resulted in several publications. In this resilience has been one of the characteristics of Rachel. She's moving on to be assistant professor at the Children's Hospital of Philadelphia, and we are going to miss her tremendously. Congratulations, Rachel.
Thank you, Dr. DeVille. On behalf of the Division of Neonatology, I wanted to present our 3 graduating neonatology fellows and highlight their outstanding accomplishments during their 3 years of training with us. First, we have Dr. Joanna Bautista. Joanna completed her medical school at University of Illinois College of Medicine and did her pediatric residency at Loyola University Medical Center. Joanna's interest in coming to UCLA for her fellowship was very apparent from the start when she interviewed here, and her determination to excel during fellowship was also clear. Joanna carefully chose her research mentor, Dr. Martin in gastroenteropeds GI, who has mentored her to success during fellowship. Joanna's research work with Dr. Martin has focused on investigating the role of the smooth muscle cell specific mechanosensitive ion channel piezo-1 in GI motility, and has found that it has also a unique role in the expansion of epithelial, crypt, and gut stem cells. She was the recipient of a T32 gastroenterology training grant for both her second and third years of fellowship. She was also awarded the UCLA Children's Discovery and Innovative Institute Fellows Research Support Award to support her research throughout her fellowship. And she's also received special recognition She has also received special recognition for her research as the recipient of the 2020 Marshall Klaus Research Grant, a very competitive research grant from the American Academy of Pediatrics section on neonatal perinatal medicine. She was also awarded the 2021 Henry Christian Trainee Award from the Western American Federation for Medical Research for her abstract, which she presented at WSPR this year. Joanna has had a steadfast commitment in regards to her intent to pursue a career in academic neonatology, and she has stayed straight on that path. Joanna is an extremely caring, kind clinician, and the breadth of her clinical training here at UCLA has prepared her for her next step as an assistant professor in the neonatology division at UC Davis, where she will be an attending neonatologist and can continue her research in PIEZO-1 and further pursue her interest in elucidating the mechanisms mediating intestinal growth and elongation, with the ultimate goal of identifying targeted therapies to promote bowel growth in infants with short gut syndrome. During fellowship, she also welcomed her son, Rian, and Joanna and her husband, Donna, are blessed with their second baby boy who is on the way. So congratulations, Joanna. We will truly miss you, but we know you won't be too far away from us at UC Davis. We will really miss you. Next is our fellow Artemy Kokanov. Art completed his medical school training at Moscow University of Medicine and Dentistry in Moscow, Russia. He then came to the United States and completed his pediatric residency in Long Island at Nassau University Medical Center and did a chief resident year there. We were very lucky to have Art do his neonatology training here at UCLA. His research interest has focused on utilizing large clinical databases with a focus on studying infants with congenital diaphragmatic hernia. And under the mentorship of Drs. Mina Garg and Allison Chu from neonatology, as well as Dr. Howard Jen from pediatric surgery, he has utilized large clinical databases to assess regional ECMO utilization in infants with congenital diaphragmatic hernia in the United States. He is also wanting to study risk factors that could predict the need for ECMO in these CDH infants. He recently presented his clinical study on CDH babies at the 2021 PAS meeting. He has also worked with Dr. Ali Chu on studying the association of severe retinopathy of prematurity and adverse neurodevelopmental outcomes in preterm neonates, and is a co-author on a manuscript of this work, which was just published in Frontiers in Pediatrics. Art truly has a passion for taking care of the most critically ill neonates and transporting the sickest infants to UCLA. There's no doubt that Art will continue to deliver outstanding care to high-risk infants and their families here in Southern California in his new position as neonatologist at Miller Children's in Long Beach, as well as he will also be attending as a neonatologist at St. John's Hospital here in Santa Monica. We very much look forward to working in collaboration with you, Art, to continue to take care of the patients you send our way. And finally, our third graduating fellow is Dr. Ben Makadangdang. Ben completed his medical school at Duke and was in the medical sciences training program there. He did his PhD studies here at UCLA under the mentorship of Dr. Kurdistani in the Department of Biological Chemistry, where he studied the evolution of histone 2A for chromatin compaction. He then went on to do his pediatric residency at University of Pittsburgh, and he returned to UCLA for his fellowship training in neonatal perinatal medicine, and currently is completing his first year of the Pediatric Scientist Training Program. Under the mentorship of Dr. Jeff Miller in the Department of Microbiology, Immunology, and genetics, Ben is doing innovative research studying the role of diversity generating retroelements, or DGRs, in providing a competitive fitness advantage for bacteria that are essential in the gut microbiota, such as Bacteroides species. The year prior to entering the PSD program, Ben was awarded a T32 microbiology training grant to support his research during his second year of fellowship. Ben has also worked extremely hard to get through his rigorous neonatology clinical training in just 2 short years. And despite the almost every weekend of 24-hour calls, sorry, Ben, he did his second year that he had to do his second year of fellowship. He always showed up ready to care for his patients and their families in the NICU with great sensitivity and thoughtful decision-making. Ben will be staying on as an instructor in the neonatology division here at UCLA and will embark on his second year as a PSDP scholar. Ben was unable to join us at the graduation ceremony today, but we congratulate him on his accomplishments during fellowship. Again, congratulations to our 3 graduating neonatology fellows. It was truly a privilege, I speak that on behalf of our faculty, to work with you over the 3 years and witness you grow into amazing neonatologists and see you continue to thrive, that you have your health and are thriving despite the high demands of these 3 years, especially this past year. We are excited to see you evolve in each of your careers, and we look forward to all the great work you will do to uniquely contribute to the advancement of the care of neonates and their families. So next up is Dr. Deborah McCurdy from rheumatology.
Okay, sorry. Well, I want to first of all congratulate all of the graduating fellows, and thank you, Dr. Enciso, for the introduction. We in rheumatology have the opportunity to work with everyone, and we love all of the fellows and appreciate them all so much. I think you all know how much we interact with you, and want to congratulate all of you. I'm very fortunate to have the opportunity today to talk about such a wonderful physician, Amy Galtney. Amy came to us from Duke. She is actually a Southern California girl, so sort of home raised, and of course loves Southern California. But she did want to get other experiences and went to Duke, and that was all to our benefit because the Duke Rheumatology Division is very strong in our little community, and she came to us with so much knowledge, and just as many of the other fellows, and insatiable curiosity. She wanted to get to the bottom of everything. She reads, she asks questions. She's just wonderful. Very early in her career, she did a quality improvement project that changed the way that we actually vaccinate and use prophylactic medications. And she and her co-fellow at the time, Stephen Wong, put on a conference and have been very helpful in helping us to protect our immunosuppressed patients. She's also been involved with CARA, which in rheumatology is a big organization. It's the Childhood Arthritis and Rheumatology Research Alliance, and it covers all pediatric rheumatologists across the United States and Canada. She's working on a special committee there for pediatric patient report outcome for children with chronic disease, and she's going to be publishing in that realm very soon. She also is working on the outcome and side effects of some of the medications we use, including methotrexate, and we'll be publishing on that. So I think you can see she is an incredibly industrious and a very brilliant scientist. But those of us who know Amy know that first and foremost, Amy is a mother, and she loves her family and her children. She has a wonderful husband, Dan, who has been so supportive through this whole time. And Isaac, who just brings joy to all of us, as you can see, and little Clara, and we think of them all every day, and we love them all. So Amy told me, excuse me, she wanted this to be short and sweet. She said, just say a saying or do a haiku. So my saying is, she came, she saw, she conquered. She came to us from a very wonderful background from Duke. She saw and educated us all and continues to educate us. And she conquered our hearts. And we're going to miss her so much. But we're so glad she's only going a little bit south to Orange County. And I hope we see a lot of her. She'll be joining the Division of Children's Hospital Orange County, and I can't tell you how many other places wanted to hire Amy, but Orange County was the place that she's going to be calling home. And so the haiku for Amy that I wanted to say is my little haiku here. Amy, so brilliant, guides us through the layered depths of rheumatology. Thank you, Amy. And congratulations, and you don't have any idea how much we're going to miss you, but I know you'll stay in touch. Thank you.
Again, congratulations to all our graduates. And we thank all the families for being here to share the special day with the graduates. Next on the agenda in the program, I would on behalf of Dr. Alan Chin and the pediatric residency, as well as all the pediatric residents, I wanted to announce the Clinical Teaching Fellow Award awarded by our graduating residents to a fellow in appreciation for excellence in teaching and outstanding contribution to medical education. And this Clinical Teaching Fellow Award goes to Dr. Benjamin Blaise for his outstanding attention to teaching our resident trainees and taking the time out of his very busy days as a fellow to spend time talking to our trainees about and teaching about his field in cardiology. Congratulations, Ben. We're very proud of you and acknowledge you for your outstanding achievement. Next, I'll have Dr. Shirin Davaskar come back, who is going to announce our Shapiro Awards. We didn't have the Shapiro Awards last year, but again, this year we had an outstanding submission of research from our pediatric fellows. And we had reviewers review all their research work and their posters. And we have chosen awardees this year for our Shapiro Awards, who Dr. Davaskar will now announce.
Thank you, Dr. Enciso. So before I announce the awards, I want to let you know what the Shapiro Family Awards stand for. This was a generous gift from a family that had to overcome many challenges in their own lives related to children. And they established these annual awards as they wanted research to make a big difference in the lives of children. In addition, they wanted to give back by acknowledging outstanding achievements by individuals who had beaten all odds in their lives to demonstrate excellence. So I must say there was a selection committee and their task was not easy. You've just heard about all the achievements of our fellows today, and we're so proud of all of them. But despite the difficult task, they did choose third years and second years with the highest scores for their scientific presentations that were held on the CDI Symposium Day. So it is my pleasure to announce them. The first one I'm going to announce are the third years, beginning with the third place first, which goes to Lisa Cohn. And her project was the epigenetics of autoimmunity. You've already heard the details. She worked with Maureen Su and studied the role of a lysine demethylase that epigenetically protected against autoimmunity, particularly against the cytotoxic function of CD8 T cells that are responsible for type 1 diabetes. So Lisa, we're very proud of you. Congratulations. And you were also the Friedman Fellow in 2020. The second place then goes to Dr. Pinna Patel. Congratulations, Pinna, for the assessment of brain prefrontal cortex in adolescents with single ventricle heart disease. And she worked with Nancy Pike and Dr. Rajesh Kumar as her mentors. And she assessed the volumes of the prefrontal cortex in adolescents with single ventricle heart disease and demonstrated an increase compared to controls. And she speculates that this relates to delayed pruning, chronic low cardiac output state or tissue injury, inflammation, or cerebral blood flow changes. She too was a William Friedman Fellow of 2021. So congratulations, Pinna. And the first place goes to Gianna Batista, who you just heard about. She was supported by a T32 and got many other research awards. And she studied the smooth muscle cell piezo-1 in the mechanosensation of the small bowel, working with Dr. Martin as her mentor. So congratulations to all three third years for winning the Shapiro Family Awards. Now, moving on to second year fellows, the third place, or the third among the three that were chosen, goes to Stephanie Raimundo, who her project was pediatric risk to orthotopic heart transplant score, insights from UNA's waitlist mortality findings, which she worked on. And so congratulations to her. The second place is Katie Strobel, who's been quantifying fetal and maternal body composition using 3D stack of radial free breathing MRI images. So congratulations, Katie. And the first place goes to Elizabeth Thomas, who's been studying anemia iron deficiency and FGF23 in chronic kidney disease in a study. So congratulations, Elizabeth, and to all the winners today, both third years and second years.
Congratulations to all the Shapiro Award recipients. Thank you, Dr. Davaskar. So last but not least, I wanted to extend our sincere thanks to all the fellowship program directors and also to the coordinators, including Nellie, Lee, Alice, and Reggie, who have done amazing work in terms of overseeing our fellowship programs alongside our fellowship program directors. A special shout out and thanks also to our research liaisons, Dr. Laura Wong and Dr. Kate Westling Perry, for all the time spent guiding our fellows in their research. And I also want to give a special shout out and thanks to Jackie Voigt, and as well as Megan Fuller for organizing our graduation ceremonies today. So all of this cannot be done without the work of all of you here, and we thank you for all your dedication. And I do finally want to announce and congratulate Alice Del Rosario for all her amazing contributions, her hard work and dedication, not only to UCLA, her 36 years of work here at UCLA, and but also for her dedication and contributions to the Department of Pediatrics and our trainees, overseeing the hematology oncology fellowships for many years, as well as the multi-fellowships of recent years as of 2019. We wish you all the best in your retirement. So that concludes our graduation ceremonies. Thank you all for attending. Thank you to all the families here that joined us today. We wish you well. We wish our graduates all the best in their next steps in their journey in taking the best care of all our children in our field of pediatrics. Have a wonderful day and the rest of the weekend. Thank you for joining us today.